Hi students, myself Jincy, lecturer from Emmanuel College of Pharmacy. Today we are discussing about the topic semi-solid dosage forms. Classification. Semi-solid dosage form may be classified into two types. First one is external use, then internal use. External dosage form of semi-solid ointment, pastes and suppositories. Ointment is for examples oleaginous base, absorption base, emulsion and water washable base. Then internal use gels and jellies. Ointments semi-solid dosage forms for external use containing with or without medicaments with suitable ointment base, either medicated or non-medicated. Types medicated and unmedicated. Medicated, either dissolved or dispersed in a vehicle as fine powder, for example, steroids. Then unmedicated ointments are used for physical effects such as protectants or lubricants. Then ointment bases. Ointment bases are classified into four general groups: oleaginous base, absorption bases, and water removal bases or emulsion base. Water soluble bases. Oleaginous bases or hydrocarbon bases. On application to skin, they have an emollient effect, protect against escape of moisture. They are effective as occlusive dressings, immiscible with water and difficult to wash off. They can remain on skin for longer period without drying out. Water and aqueous solutions in small amounts can be incorporated with small difficulty. When powdered substances are to be incorporated, liquid petroleum is used as levigating agent. They include petroleum, white petroleum, yellow ointment and white ointment. Then absorption bases. Two types, those that permit incorporation of aqueous solutions resulting in formation of water in oil type emulsions. Those that are already water in oil emulsions are permit incorporation of additional quantity of aqueous solution. They include lanolin, anhydrous lanolin and cold cream. Then water removable bases or emulsifying bases. They are oil in water emulsions having an emulsifier which makes them readily miscible with water. They may be diluted with water or aqueous solutions. Because of their surface active property, they facilitate contact between skin and medicament. Readily water washable. They include, for example, hydrophilic ointments and vanishing creams. Then water soluble bases. Unlike other bases, they contain only water soluble components. Greaseless bases. They are completely water washable. Aqueous solutions cannot be incorporated efficiently because they soften greatly with water addition. They mostly are used for incorporation of solid substances. These bases are used for local anesthetics and are used when easy washing from skin is required. They include peg ointment, creams. Second one is creams. Semi-solid dosage forms for external use containing with or without medicaments with suitable fatty base. Types of creams: aqueous, which means oil in water, and oily water in oil. Aqueous, example, anionic, cationic, and non-ionic waxes, polysorbates, and triethanolamine soaps. Then oily water and oil type, example, wool fat, wool alcohols, beeswax, calcium soaps. Then third one is pastes. A semi-solid dosage forms for external use containing high proportion of finely powdered medicaments with suitable fatty base. For example, zinc oxide, calcium carbonate and starch, etc. Antiseptic, protective, soothing dressing. Then fourth one is gels. Transparent semi-solid dosage forms for external use containing hydrophilic or hydrophobic base gelling agents. Then fifth one is poultices. Semi-solid dosage forms for external use containing medicaments applied to the skin to hold the dressing and protective. Then advantages of semi-solid dosage forms. The major advantage of a semi-solid dosage form is that it can be applied directly to the affected area. It gives prolonged the action and does not need to be administered orally. It is convenient for unconscious patients or patients such as children and old people for whom oral administration is difficult. Semi-solid dosage forms are more stable in atmospheric conditions than liquid dosage forms and solid dosage forms. Then it is soluble for those active pharmaceutical ingredients that are low density and amorphous hygroscopy. Different drugs and excipients or ingredients can be added together to form a single dose. It gives better adhesion and lasts long after application. Hence, the medicament give longer action. It is washable after each use. It is used externally, thereby reducing the risk of side effects. It does not harm the gastrointestinal tract as it does not need to be taken orally. The semi solid dosage form is more convenient for patients than other forms of drug administration. It is suitable for medicaments with a bitter taste and as it is does not need to be taken orally. Then, disadvantages of semi solid dosage forms. The major disadvantages of the semi solid dosage form is that it has no dose accuracy and it needs to be applied directly. In general, pharmaceutical creams, ointments, gels, suppositories, and paste are greasy and they difficult to clean. The semi solid dosage form is less stable than the solid dosage form. The need to apply with the fingers every time can cause contamination. Some patients may become irritation or allergic. Semi-solid dosage forms are usually a costly dosage because its manufacturing process is complex. Semi-solid dosage forms are physiochemically less stable compared with the solid dosage form. Clothing staining is often associated with the use of creams, ointments, gels, and paste. The base used in the dose may be oxidized. Thank you.